Hello everyone, I am Dr. Ghanee. I am an oral pathologist. Today I'm going to talk about fungal infection or yeast infection in the mouth. Yeast infection, fungal infection, thrush, candidiasis, they are all the same thing. The fungal element that grows in the mouth is called candida, and overgrowth of candida is called candidiasis. Candidiasis has different forms. It can show up in the mouth with different forms. One form of it you are familiar with, pseudomembranous candidiasis, when candida, this fungal element, makes white cheesy spots all over the mouth that you can scrape it off. And actually that white cheesy stuff is colonies of this fungus, candida, all over the place. But today I'm not going to talk about pseudomembranous candidiasis. I am talking about hyperplastic candidiasis, which means this fungal element is growing and growing chronically for a long time, and it causes actually tissue growth in the mouth. Look at the left side of the tongue here. If you put a piece of gauze there and rub against that surface, you cannot scrape it off. The tissue grew. When we have callus on our fingers, when we touch it, we can tell that the tissue grew and it's very thick. We can tell that. But the color of it is exactly like skin color. In the mouth, when surface grows, always is white. So it's interesting that this fungal element growing in this mouth caused actually hyperplasia, caused tissue growth. This particular patient had diabetes and her diabetes was not under control. So I sent her to her primary care physician. They worked with her. It took 2 months until diabetes was under control, and I gave her antifungal rinse. And as you can see, all that white is gone and tongue is back to normal. In my future videos, I'm going to talk about other kinds of candidiasis. This kind, hyperplastic candidiasis, is not very well known and usually confuses the patient or even the nurse or even the doctors, medical doctors. We all know about pseudomembranous kind, but this kind is not very well known. That's why I put this kind first, and in my future videos I'm going to talk about other kinds of fungal infection in the oral cavity. Thank you so much for watching. Have a good day.